Why does a patient of stroke presents with spastic paralysis and a patient of Guillain-Barré Syndrome presents with flaccid paralysis? So it all depends on the position of nerve lesion. So here in this video we are going to simplify upper motor neuron lesions and lower motor neuron lesions. And also at the end of the video I shall give you guys a very small tip that will help you all to remember the difference between upper motor neuron lesion and lower motor neuron lesion. And believe me, after that you guys will never forget that. So firstly, talking about the upper motor neuron lesion. This upper motor neurons connects between our cerebral cortex to our spinal cord. You can remember upper motor neuron as an inhibitory boss which actually regulates the work of lower motor neurons. But there's also a crucial role. It also exerts an inhibitory action so that the muscle completely doesn't go into overdrive mode. So what happens when there's a lesion in the upper motor neurons, like in the case of stroke? In that case, the inhibitory action is absent. That is why such patients present with spastic paralysis. And the muscle tone is higher, that is hypertonic muscles. The reflexes also gets higher, that is hyperreflexia, and also you will get a positive Babinski sign. Now talking about the lower motor neurons. This lower motor neurons connects between our anterior horn cell of spinal cord or the motor nuclei of brainstem directly to the muscle. So, if there's any lesion in the lower motor neurons, like in case of polio or in any case of peripheral neuropathy, like in Guillain-Barré Syndrome, so here what happens, the connection between our muscles is lost. And that is why in such patients you will get flaccid paralysis. The muscle tonicity will be reduced, that is hypotonia, and the reflexes will be very much reduced or absent. If it is reduced, you will call it hyperreflexia, or if it is absent, then it is called areflexia. And also in such cases, the muscle will be atrophied. So now, how you can actually remember them? As I promised you all, this time for the cheat code to remember the upper motor neuron lesion and lower motor neuron lesion. Remember the upper motor neuron lesion with up. That in these cases, everything will go higher. Like the muscle reflexes will be higher, tonicity will be higher, Babinski sign positive. Now for lower motor neuron lesions, remember with down. Everything will go downwards or reduced. Like the muscle tonicity will be reduced, the reflexes will be reduced, and also the muscle will get atrophied. So that was everything for this video. I hope after this one, it will be impossible for you all to confuse between upper motor neuron lesion and lower motor neuron lesion. Subscribe to the medical files for more such educational videos. And also check out our community tab because there I upload daily NEET PG pattern medical quizzes. Thanks for watching. Have a nice day. Stay safe, keep studying, and bye.